How diabetes affects the lymphatic system. Back to nature. Diabetic. The lymphatic, lymph, system is an important part of the immune system. One of its jobs is to protect the body by fighting infections. It also drains excess fluid and toxins from tissues and cells. In addition, it transports lymph fluid, which contains infection-fighting white blood cells, to the body. Blockage, disease, or infection can affect the lymphatic system. Diabetes can cause damage to the lymph system because high blood sugar can damage the arteries and capillaries of the lymph nodes. As a result, lymphedema can develop. The lymphatic system comprises lymph nodes, ducts or vessels, and organs. Lymph nodes are in the neck, armpit, chest, abdomen, and groin. In addition, the tonsils, spleen, appendix, and bone marrow are also part of the lymph system. In a nutshell, they work together to move lymph back to the bloodstream. Lymphedema occurs when tissues swell because of an accumulation of fluid, edema, that is not drained through the body's lymphatic system. Damage to the lymph system can prevent fluid from returning to the blood. It usually affects the hands, arms, legs, feet, and ankles, but can also occur in the face, neck, and abdomen. While there is no cure for lymphedema, there are treatments for reducing the swelling and complications. Signs of lymphedema: swelling in the breast, chest, shoulder, arm, or leg, tight or heavy feeling skin, burning or itchy skin, inability to move or flex joints, jewelry and clothes not fitting and feeling tight, recurring skin infections, fluid leaking through the skin or developing blisters, hardening and thickening of the skin known as fibrosis. Risks and treatments. There are many risks to developing lymphedema, but there are also many natural remedies. Risk of skin infections. Difficulty walking and restricted range of motion. To prevent cellulitis, keep your skin clean and treat cuts and cracks on your skin with soap and water and apply an antibacterial ointment. Bacteria can enter through broken skin, causing cellulitis. Also, many diabetics have dry skin. This is because excess sugar in the blood causes the body to pull fluid from its cell to produce enough urine to remove the sugar. This leaves skin dry and causes itchiness. Dry and cracked skin also increases the risk of infection. Therefore, it's important to not scratch itchy skin, moisturize, and manage blood sugar levels. Natural remedies for lymphedema. Elevate your feet and arms if they are swollen. Use compression socks and bandages. Avoid tight clothes, especially with tight bands or elastic. Get a massage or manual lymphatic drainage. Lose weight if needed. Don't cross your legs when sitting. Avoid applying heat or cold to affected limbs. Exercise is good for the lymphatic system because it stimulates lymphatic flow. For example, exercise works muscles, increases the flow of lymph fluid, and moves it away from swollen areas. One of the best exercises is rebounding, also known as jumping on a trampoline. Along with physical exercise, you can also do deep breathing exercises, which stimulate the movement of lymph fluid. In addition, dry brush your skin with a natural bristle brush which increases blood circulation and promotes lymph flow and drainage. Brush your dry skin in a circular motion for 10 minutes before taking a shower or bath. Another great exercise is ankle pumps, which are one of the most effective ways to reduce leg swelling. You can do them on the floor, bed, chair, and recliner. Foods that promote lymph flow. Green leafy vegetables such as spinach, kale, and arugula lettuce. Low-sugar fruits such as berries. Cruciferous vegetables like broccoli, cabbage, cauliflower, and Brussels sprouts. Citrus fruits like lemons and limes. Water. Foods that make lymphedema worse. Alcohol. Hydrogenated fats and trans fats. Sugar. Caffeine. Salt. While diuretics may seem like a good way to remove excess fluid, they can be harmful. This is because they can dry out other parts of the body rather than the lymphedema, but you should check with your doctor. While diabetes may increase your risk of developing lymphedema, there are many natural remedies, most of which you can do at home. However, visit your doctor if you have persistent swelling or a skin infection. Please remember this is not medical advice or intended to replace the advice of your doctor. They are not intended to cure any disease. Please do not self-diagnose. Always check with your healthcare provider before trying new treatments. I ask you to please keep an open mind, be a diabetic detective and do your own research, work with your healthcare team, see what works best for you, and monitor your blood sugars.